Good afternoon, everyone. My name is Audrienne. First of all, let me pause. I apologize for the delay. I had technical issues. Zoom can sometimes be the devil. Good afternoon. My name is Audriana Marzette, and I will be the moderator for today's listening session. I'm a public health program coordinator with the National Indian Health Board. Thank you for joining us, and thank you for your interest and sharing your insights and wanting to be here to discuss the Centers for Disease Control and Prevention's COVID-19 mask guidance around community use of masks. We are joined today by Dr. John Brooks and Dr. Michael Bell, both from the Centers for Disease Control and Prevention. John and Michael will both be with us today. Before we go into Q&A, they're just going to talk about which mask offers the best protection, why we should wear masks in public and around people who may not have the strongest immune systems, who live in the same household as us, but then also talk about how we can prepare for future variants. So some quick housekeeping. Next slide. We will not be recording this whole session. We would just record the beginning of the presentation with the slides, but then when we go into Q&A, we will not be recording so that everyone can feel comfortable with sharing and feeling comfortable with just having that one-on-one intimate time. All participants have been muted. During the presentation, you may ask questions. Next slide. Simply click the Q&A and type your questions into the free text field. The moderators and guest speakers will either send a typed response or answer your questions live. You all, as attendees, can also upvote and comment on open questions if you wish. We only have this 45 minutes together, so we want to make sure that we're using it to meet your needs and to make sure that we are engaging with you. By clicking the chat button, you can communicate with the panelists, Evelyn or myself. Do use the chat if you have any issues during this session so that if Evelyn or myself can assist you. And to leave the webinar, simply just click leave meeting. Next slide. So the purpose of this listening session is to hear directly from you. Community members from American Indian, Alaska, Native, Asian American, and Native Hawaiian Pacific Islander communities. The National Indian Health Board is a nationally recognized organization created by the tribes over 40 years ago to advocate for improved health for American Indian and Alaska Native communities. NIHB is the only national organization of its kind, serving all federally recognized tribes and advocating on all issues related to health and public health in Indian country. The Association of Asian Pacific Community Health Organizations, next slide, is dedicated to promoting advocacy, collaboration, and leadership that improves the health status of access of Asian Americans, Native Hawaiians, and Pacific Islanders within U.S., its territories, and freely associated states. Now, at the end of today's session, we will have learned your opinions and ideas about CDC's mask guidance. We want to know, what do you like? What do you do not understand? What is not clear in the messaging? What should be changed? We want all of this information, the good, the bad, the ugly, whatever, we want it. This isn't to say that today's discussions will solve the community concerns addressed all by itself. Rather, this information will be summarized and used to inform the efforts undertaken by community leaders, local organizations like NIHB and the CDC to make more informed community messages and resources to address emerging and re-emerging public health threats. Now, with that information, I hope it wasn't a lot. I would like to introduce our speakers. As I said before, we are joined by Dr. John Brooks. He is a medical epidemiologist with the Division of HIV/AIDS and Prevention, the National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention. He presently serves as the Senior Science Advisor for the CDC's COVID-19 response. Dr. Brooks has led teams during the CDC emergency responses to anthrax, SARS, Ebola, and Zika. Brooks came to CDC as an EIS officer in 1998 after completing medical school, a residency in internal medicine, and a fellowship in infectious diseases through Harvard Medical School. And we have Dr. Bell, who is the Deputy Director of CDC's Division of Healthcare Quality Promotion. He received his medical degree from the University of Washington and trained in infectious diseases at the University of California, San Francisco. His career has focused on investigating and preventing the transmission of healthcare-associated illnesses. Project First Line, developing evidence-based infection control guidelines and optimizing care systems. Before his current position at CDC, he was the chief of the epidemiology unit at the Viral Special Pathogens Branch, addressing the control of high-risk pathogens. So without further ado, I will now turn it over to Dr. Brooks and Dr. Bell. And following their presentation, we will go immediately to Q&A. Thank you.
Audriana, thank you. That was the most energetic introduction I have had in years. So thank you. Next slide, please. But let's get going, because what we want to do is go through some slides with you. And I'll let you guys, you all are advancing the slides. Is that right? Good. So you just go to the next one. And let me know if I'm supposed to be seeing something yet.
Share screen, Evelyn.
So while Evelyn's pulling that up, just want to say we're really glad to be here today with you. I know it's taken some time to get us all together at this hour. We want to listen to your questions, your opinions, your positions, as Audriana mentioned. We will talk a lot about masks. We got some questions ahead of time that we'll walk through. So some of the questions you're already anticipating, hopefully we'll be able to address those. And I'm going to provide you some information now about background. To go ahead to the next slide, please. Just some background about why did we recommend masks for COVID-19. You can skip this slide and skip that slide. You heard all the dirty details, and we don't need to revisit that. But do let me talk about what the most important thing for you to walk away from this talk is, which is to at least understand how is COVID-19 spread. And for those of you who have not been conscious since January of 2020, I'll just note that this is indeed a disease that is spread by breathing. When you're close to an infected person who's exhaling small droplets and what we call aerosols, these very microscopic tiny particles that can contain the virus. So you're breathing in air exhaled or secretions exhaled by a person who's infected. You can also have those little droplets and aerosols actually land on susceptible tissues on your face. So like on your eyes or in your nose or your mouth. And this can also occur through what we call a splash or a spray, which is maybe technical jargon for a cough or a sneeze outside the healthcare setting. And then, of course, there's the possibility that you could touch something, have virus on your hand, and then inadvertently touch your mouth, your nose, your eye, as I just did, and transfer it that way. But I think evolving evidence, although we don't know which of these is the lead winner in terms of where most infections are attributable to, the ones we want to pay attention to today are the top one, the issue around breathing. We know that's a major mode, and it's one where there's a lot of opportunity for control at a population level. Next slide, please. So these are some of the prevention strategies that we've put together. And the point I just want to make here is you can see that wearing a mask over your nose and mouth is the main prevention strategy many of you have heard about. But the best prevention strategies are those that are layered together so that you're using multiple different ways to try and prevent infection, because no single strategy is in itself 100% infectious. sorry, 100% effective, excuse me. I mean, even vaccination, which is remarkably potent, is in itself not 100%. And as Adriana mentioned, we have a lot of concern for people who, for instance, may not respond well to vaccination due to immunocompromise, or persons with disabilities have difficulty doing some of the things we recommend here. Next slide, please. So let's talk a little bit more about masking. It's not a new idea. It was present during the 1918 influenza pandemic, and I highlight in yellow and then wrote off to the right some of the things that were recommended over 100 years ago to control the flu pandemic, just to illustrate how things have not changed. I think these will ring familiar to you, that what we're saying to prevent COVID was to maintain distance, ensure ventilation inside is sufficient, isolate a sick person, avoid crowded settings, and of course illustrated by the nurse model here, wearing a mask. It goes all the way back to there and maybe even before. Next slide, please. So one of the reasons we really want people to wear masks is your symptoms, or whether you feel sick or not, is not a reliable indicator of whether you might be infectious to other people or whether you have the infection. It's important to know that among infected people, over 30% never develop any symptoms. They can be infectious, they can infect other people, and never have any symptoms to let them know that they are sick. Among people who do develop symptomatic illness, though, we also know that the risk of transmitting to someone else peaks just as their symptoms are coming on, in the day before or two before they get sick, and then shortly thereafter. So even for people who develop symptoms, there's a period of time before they've got those symptoms that they can be infecting other people. We estimate, therefore, that about 50% of infections, this may have changed with vaccination now, but because these slides were prepared prior to the more widespread use of vaccination, but at that time, and probably not so far off now, about 50% of infections are transmitted by people who don't have symptoms. And so half of all new infections are coming from people who are unaware they're infectious to others because they don't have symptoms. Next slide, please. So why did we talk all about cloth masks? I just want to level set for people and remind them that when we were aware of how important this was back in the middle part and early part of 2020, the availability of these high-level N95 masks that we talk about now just weren't there. There was low supply. We need to reserve those for the healthcare sector, because if the hospital can't manage patients, then all of us are in trouble. But we did know this principle of source control, which is what I want to talk to you about. And you could achieve that using cloth masks like they did back in 1918. We emphasized universal masking of everyone to reduce the spread, because this would slow the dispersal of airflow coming out of coughs and exhalations from a person who was infected. And remember, a lot of people can be infected and don't know it. So the idea was, as shown in the illustration below in the first row, that the source, the infected person, by wearing a mask, is blocking the infectious material coming out of their respiratory tract and getting into the environment and possibly exposing another person. That's called source control. Now, I'll add that even though these were not the top level mask that you could get if you had to work in a hospital intensive care unit, even so, they provide some protection. It's not perfect, but you also had some protection as the wearer by wearing that mask. We know it reduced what you inhaled. Next slide, please. And the principle here is really understanding what happens when everybody is wearing masks, right? If we get everybody in a community wearing a mask for source control, and we add to that the benefit that you get from wearing the mask as well, what does that translate to in the risk for each person who's in that community of people in terms of getting sick? So this is just an illustration of a setup that we use to try and measure that. We don't usually do studies with human beings who are sick and try to have them infect other people. That's fraught with a lot of ethical difficulties. So we really do have to rely on these kinds of modeling experiments. Next slide, please. And let me show you what some of the results of that were. Shown here in this figure are, on the left column, a person who is a source, who's exhaling virus. In this experimental model I showed you, we used a substitute for what would be the particles that we measured, but we considered it equivalent to what a person is likely exhaling if they have COVID. On the right, we could then detect what was picked up by the receiver. And what you see in the graph on the right are color-coded by each of these 4 scenarios descending on the left, how much of the material that was exhaled by the source was inhaled by the receiver. So let's look at the blue line as the first example. In that situation, when you put the people 6 feet apart, and in this circumstance we had, about 20% of just distancing 6 feet reduced substantially what the receiver was exposed to. About 20% of what the source exhaled got to them, but 80% didn't. So that was some reduction. And then if I put a cloth mask, and we're talking just about cloth masks in this circumstance, on the receiver, that increased the reduction. You get about a 90% or 10% residual. And in the gray circumstance, if I mask the source, that's even better. But what if I did both? That's where you're really getting the bang for your buck, is you're getting 95% or below reduction in the risk of that receiver picking up material from the source. Next slide, please. Oh, next slide. I'm sorry. I had it staged to walk through these individually, but I've just done that verbally. So we can go back and enjoy that later if you'd like. But the idea of this is that by getting people in a community together to all mask, we reduce the spread of COVID to everybody, and it protects all of us as a group. It's most why we know that this principle was going to be most important in large public settings. We just have some notes here about who should and should not wear a mask. It still remains the case that we don't recommend masking for children under 2. There are issues around the shape of their ability to wear a mask correctly, and then it could pose a choking hazard, or other people who can't manage a mask. You can imagine, I don't know how many of you've worked with disabled folks or people who have autism, or folks who it's very difficult for them to help teach them how to wear a mask. So they're exempted from this requirement as well that CDC put out. Next slide, please. I won't go into great detail about how to clean these and wash them and wear them. The most important thing, though, is that when you're using a cloth mask, the beauty of these is they are very reusable. You just want to be careful putting it on that you don't inadvertently touch your face, and that when you take it off, you remove it carefully so that this thing that might be contaminated gets to the place you're going to wash it or store it temporarily until you use it again, so that you don't cross-contaminate yourself. Next slide, please. You can wash it in a washing machine. You can wash it by hand in a sink. Any of these are just fine. Tap water and laundry detergent does great. Hand drying is perfectly fine if you don't have access to, let's say, an electric dryer. In fact, some people would argue that putting it out in the sun might actually add a little bit of sterilization from the ultraviolet light you get in sunlight. Next slide, please. Drying it, just discussed that. Next slide. So our recommendation has been, until this has not been updated since the new community levels came out, but the concept here is that CDC recommends unvaccinated people wear a mask in public settings when around people who don't live in your household. And that's both because they're at higher risk of becoming infected as a result of not being vaccinated, and therefore we want to help reduce their risk of transmitting to others, and also of getting infected themselves. Skip the middle one, the bullet. This has been updated, and we still recommend indoor masking, although not in these circumstances, but certainly in the healthcare sector. And Mike, I don't know, you may want to mention that later, that the requirement for indoor masking may not apply to these settings any longer, but in the healthcare sector, it's a bit of a different story. We need to keep that sector safe. Next slide, please. So what can you do if you've got a cloth mask to make it work better for you? Because people were dismayed. They were like, oh, these cloth and these surgical masks, they're not the preferred product. What can I do to make it work better? And this is an example of a mannequin wearing a surgical mask, and you can see that when that person exhales, these particles that are being visualized through the mist we used are escaping through some of the edges of the mask, not going forward into the face of the person that they may be talking to, but certainly some of them are escaping. Next slide, please. So first, make sure, how can you improve the effectiveness of your mask? Make sure that it fits. Fit and filtration are the name of the game. A loose-fitting mask, a mask under your nose, one hanging off your chin, those don't do a hill of beans of good. You got to get it over your face. You want to get that fit as tight as possible. Snug, no gaps, so the air can leak in and out. And multiple layers matters. We no longer really see masks made with a single layer, but multiple layer masks work better, and particularly if they have different kinds of materials in them. Most of the cloth masks that you could now purchase on Amazon or at a store, or you might receive from the health department, are multi-layer masks that include multiple materials. Next slide, please. You could also do something called double masking. And this is the principle of taking a surgical mask, which can be a little bit loose around your face, that's the blue mask, and putting a cloth mask over it. And the purpose of the cloth mask, both it adds a little more filtration, but more importantly, it presses down the edges of that surgical mask against your face for better seal. And that was shown to be more effective at preventing transmission. Next slide, please. You can also do things like knotting the corner of the mask in a certain way, or folding it in a certain way. And all of these things are on a website at the very end of this presentation that we can maybe put in the chat as well, where you can go in and see videos on how to do this if it's something you'd like to consider doing. You may in fact have seen people walking around with some of these. Next slide, please. And then lastly, there was a lot of discussion early on about these things called fitters. So on the leftmost figure, you can see the knot and tuck idea that if you, by tying the ear loops close to the mask in a knot, you kind of bring all that material together and seal it tighter against your face. But you could also use some external devices. You could use what I mentioned before, putting a cloth mask over your face. You could to push that surgical mask tighter. And then there are things called braces or fitters that you could buy to make them fit more tightly, and even a nylon sleeve. I'll tell you, queen size hose are the recommended size, and you take the upper thigh part and you can use it like a neck gaiter to make that mask fit tighter against your face. All of these have been researched and shown to be effective at improving the performance of these cloth masks. Next slide, please. How do you know if the quality of your mask is really any good? Well, there weren't, although there are standards for the masks you see doctors and nurses and healthcare professionals using in hospitals, there weren't standards until recently for cloth masks of this kind that you might buy through Amazon or at a store. Well, that's changed. There are now official recommendations on what the standards that these masks must meet, and companies voluntarily can try to meet those standards, and if they do, then put a label or a mark on their mask to illustrate that this mask has met a certain standard, and so you know that it's good quality. Next slide, please. This sort of repeats what I said in that previous illustration about two masks, but this is repeating the same idea, but using masks now that are treated in sort of different ways. So what we're doing is looking at three scenarios, whether the mask is on the source in the leftmost column of 4 results, in the middle on the recipient, or if both are wearing them. Next slide, please. And if I recall how this advances properly, the better the better fitting the mask is. So a surgical mask in orange is okay, but knotting that surgical mask even reduced the relative concentration of exposure lower, and then putting a cloth over a medical mask, you even got more bang for your buck, right? In both what this receiver was exposed to when the source was wearing a mask, or what the receiver received when he or she was wearing a mask. But look at the rightmost column. Next slide, please. In all these cases, when everybody's wearing them is when you get the most bang for your buck. And I guess that's the bottom line message here is, again, many people doing it gives you the best bang for your buck. Next slide, please. And we are getting to the Q&A, which is coming up hopefully very shortly. I appreciate it, Brandon. You're absolutely right. This is just to illustrate that we know masking works epidemiologically. There are multiple studies now that have shown masking reduces transmission, from outbreak investigations, from epidemiologic studies, from huge community studies. Next slide, please. So just want to talk a little bit about safety. People often raise concerns. Are these masks safe to wear, right? Well, they've absolutely been shown to be safe for adults and children. They don't cause people to retain carbon dioxide or to not get enough oxygen to breathe. And there have been studies where they put these onto high intensity athletes and pushed them to the max. And it's only under those circumstances that you may begin to see a little bit of change in the amount of oxygen they're getting, but not so much that is meaningful. For average people, you, me, and even some sick people, the the subjective distress that some people report, feeling, I don't like this on my face, I feel like I'm suffocating or I can't breathe, at least physiologically, we know it's not causing them to have problems. And we also know that there has been no effect on memory or cognition. I mentioned this because many people were reasonably concerned that children were missing a lot of school, and if these masks did something that messed around with your amount of oxygen you could get or blowing off carbon dioxide, would it affect your ability to learn language or to form good memories, to learn in school? And of course, wearing a mask covers your face, so could kids really learn how to speak or see how a mouth moves? And there've been nice studies now that show that that's not a problem for at least school-age children when in a situation where adults and children are masked. Next slide, please. So I wanted to move as quickly as we could to the questions we got from you. And let me go to the first set. And Mike, maybe
John, before we start,
let me ask if you have any points you want to add.
Yes, please. So, hey everybody. Good morning, good afternoon. Very good to be talking with you. I want to just collapse a lot of what John just said because he gave you a lot to some basic things. First, there's not just one solution. It's not masks and nothing else. There's a lot that goes on here, right? Further is better than close. Outdoors is better than indoors. Cover is better than no cover, almost no matter what it is, right? Even a simple cloth mask. But a better cover of your face, a mask, is a better thing. So it's not just cloth masks that we recommend now. You can use surgical masks. You can use N95 respirators or KN95s. Those are all fine. They both protect your nose and mouth, and they keep things from landing in your nose or mouth. They also keep you from breathing them in. And what John said was the fit is key. If it's leaky and you're breathing in through the sides, then it's really not doing as much good as it should. So wear a mask that doesn't leak around the edges, but also pick a mask that you can use all the time, right? If you're always taking it off because it feels terrible, it's not going to work. Anthony asked about big faces. I join you in this challenge. Try a lot of different brands, right? This is not easy. There isn't a good label that says, small, medium, large, extra large that we can really predict. But if you try a few different brands, you can generally find one that'll fit better. Sometimes the one that's shaped like a duck, the duckbill masks, those tend to fit a little bit better because they flare out more. But you can try a bunch of different ones. You're not alone. People with tiny faces, also have a challenge because they get gaps. And for those folks, again, try a couple of different brands. But also then consider putting a cloth mask on top of something so that it presses against your face. So that's all I wanted to say. If any of you have heard the Swiss cheese model, right? You can't go all the way through the Swiss cheese through one hole because there's a blockage. When you make the slices, all of the slices add up to protect you. And so it's masks, it's outdoors, it's distance, it's good air indoors, all of that together.
Mike, you're so sage. Thanks. That's really helpful summary of a lot of stuff. And I wanted to also add, the other problem is I have a big nose, and I have a lot of trouble finding these N95s that fit and get close. And so I've had to try a lot of different ones to get one that works. So we grouped these questions into the kind of different types of questions that we're asking. One was, what kind of mask should I use? And I don't know, Mike, do you want to, it might be good for you to maybe, if you wouldn't mind taking this one, what is the best mask for an immunocompromised person or somebody who can't be vaccinated?
So again, no mask is going to work if you don't wear it, right? So people can be pulled into buying extremely robust respirators, but realize those fit super tight. They're hard to wear for a long time. Some people get headaches. Other people get face irritation. And also, if you're like me and John and you have whiskers, then the seal doesn't actually work. It creates a gap. So they're not giving you everything that they might. That said, a high quality N95, KN95 is a good choice because it's made of good material that filters well, assuming it fits you. So that's thing number one. Thing number two, regardless of your immune status or anything else, you want to buy or use the best mask that you will wear all the time. And so I know I'm saying this over and over again, but it is kind of the bottom line. Don't buy a great mask that you hate wearing. Buy a really good mask that you love to wear.
Mhm.
And think about the importance of wearing it the whole time to protect yourself. And also, if you're wearing it for source control, to protect the people around you.
Yep. That's right. So the difference between these different kinds of masks that are listed here are all in the category of what Mike was referring to as respirators. Those, sort of the fancy ones that you can buy with either two straps or ear loops. And all this basically means is that they are filtering out the number represented. Okay, so if it says N95, 95% of material, at least 95% material, is being filtered out. At what size? I can't remember, Mike. If it's 1 micron, less than a micron, but it basically refers to the quality. So there's really no salient difference. The letters come from the place in which they were manufactured. I believe K is for, is it China or Korea? KN.
The KN95s come from Korea.
Korea.
The KF94, I believe, comes from China.
Yeah.
And the N95s are registered by our National Institute of Occupational Safety and Health. The 95 means if you glue the filter material to a machine and try to force stuff through it, how much does it trap? So again, that's the filter material. But if it's got a big gap on the side of your face, then it's not going to be 95. It's going to be 65, maybe 50, right? So the fit remains really, really important.
Yeah. And so to the teacher's question here, echoing what Mike has just said, the best mask is going to be the one that's the highest quality that you can wear consistently and correctly for the time that you need to wear it. So again, some people jump to, I think I really need to be wearing an N95, and find after 15 or 20 minutes, they're ripping it off their face. It's so uncomfortable. But if you can get a good triple layer or double layer cloth mask, or do a surgical mask with a cloth mask over it, that can afford a lot of protection, and that protection is better than the lack of protection you'll be getting from buying something that's high quality you can't wear properly. And then with regard to face shields, our advice remains that face shields are not sufficient to protect you, to either reduce, to provide source control, or to protect you as a wearer, at least from inhalational risk. But if it's possible, you're going to be exposed to a lot of droplets that may land in your eyes. Then wearing glasses or eye protection, such as a face shield, could be recommended.
John, I'll jump to a couple of comments that we got on the Q&A. Clifford Myers was asking about the training and fit testing that's normally required for respirator use. And you're right, for work settings, that's what we require. The use by the general public is really based on having a higher quality product than a lot of the disposable masks that are not respirators. So you're getting a little bit more of a robust mask. To your point about 85-year-olds, you should never put anything on anyone that keeps them from breathing safely, right?
Right.
So we don't want people to be wearing something that they can't. If they have trouble breathing, they shouldn't wear it. That is one question. And right after that, we got another question about washing N95s. Those are not washable. These are disposable. You can keep using them if they're clean, but if they get dirty, you need to throw them away.
Yeah. And you can certainly store them in a bag if you want, but absolutely don't put it in the washer or dryer. That will wreck its effectiveness for you. Okay.
A word about face shields. John pointed out that they don't keep you from breathing things in, and they don't keep you from breathing things out. They do protect your eyes from splashes, and that's why we recommend them in healthcare. In healthcare, where somebody is taking care of patients and you're face to face really close, protecting your eyes from someone who might accidentally cough on you, especially if you have to take their mask off to look in their throat. That's when face shields become really, really useful. In the general community, there's generally not a good reason to be wearing a face shield.
Yeah, we don't have good evidence that getting infected through your eyes for the general person is a meaningful route of infection, but it could be in these special circumstances that Mike mentions. Let's go to the next slide. Is it true that glass fogging is an indication that the mask is leaking and not providing adequate protection? You bet. That's a good indicator that you've got a leak. and it's not fitting tightly enough to prevent that warm air you're breathing out from fogging up your glasses. And it's a good sign that you may need to do something to make it fit better or look for a mask that fits better. Mike?
Yep, I agree. It means there's a gap. On the other hand, remember the picture of the lady wearing a mask with the white smoke shooting up? It means that you're at least not shooting stuff straight at other people. So it's doing
Yeah,
something, right? It's kind of
right.
like putting your hand in front of your mouth when you cough. It's that. So
Yeah,
it's not a zero usefulness thing, but it means that you do have a gap. So from the wearer protection side, it means I can be inhaling past the filter, and that's not what we're after.
that's right. And if that's something you're concerned about, you can consider getting, if you can't find a mask that fits itself well, some people use paper tape or other kinds of amendments to try and help get that to fit a little bit better. And if it's a surgical mask that's doing that, this is where putting a cloth mask over it to enhance the seal can be very beneficial. Next slide, please. So is it true that carbon dioxide builds up in surgical masks or deprive your body of oxygen? Absolutely not. The only in the most extreme circumstances do we begin to see a little bit of any of this, and it isn't physiologically meaningful. We're seeing it because we're trying to measure it so well. But we've got experience from older people who have chronic obstructive pulmonary disease. We've got data from children of various ages down to below age 2, which we don't recommend, but they did the research putting a mask on them, from high school athletes, and from people just going around their daily business. And in none of these cases has wearing a mask led to any meaningful buildup of carbon dioxide or deprivation of oxygen. Next slide. Mike, could you respond to this one, the mask certification?
So I wouldn't worry too much about this in the household and community setting. Really, the fit is the primary importance, and then filtration is the other piece. When we talk about N95, that's NIOSH certification for that filter that I talked about earlier. And so that's what you're getting. It's important in the workplace. There are standards and requirements there. The difference between NIOSH certifications versus FDA clearance is all about what they claim to do. So for products that claim to have a medical benefit, FDA requires them to be cleared with a special label claim. Those are things that are less about what we're trying to achieve in communities. I think Yvonne Myers had a question about we're seeing less recommendation of masking across the country. And that is, I think, a reality that is reflecting how communities are wanting to go back to something a little bit more normal. I think my message would be that it's not just about regulations. It's also about what you can do to protect yourself and your family. I think of my masks, which I still use, as a tool. Just like I would carry earmuffs if it were cold, or if you're in a tropical location, I would carry a raincoat or an umbrella during rainy season. I carry my mask with me when I might be going indoors with a lot of people around.
Yeah.
I don't want to take a chance. I'm vaccinated, but I still like that extra layer of protection, like the Swiss cheese I talked about. So think about it as that extra tool that you can use to increase protection, and also reduce the risk of exposing somebody else, and keep it handy. It's just a tool. There's nothing magical about it. And I think we're probably in a phase where we need to think about how we use that tool into the future, right? We don't want to only use it when we're told by the state government that we have to. We want to pull it out and use it whenever we think it's a good idea.
That's one of the reasons we want to speak to you all today, is because the pivot that's taking place is that we're as public health professionals, for ourselves and for others, we're trying to arm people with the information they need to to make the informed decision for themselves how to use this tool the best way possible. And I know that some people have a lot of concerns about, well, what about people who are immunocompromised and unvaccinated? This is a place where we as responsible citizens can help by wearing masks in public settings if we're worried about that possibility, asking about a person's, asking about, are people vaccinated or immunocompromised if they're coming to a social event in our home? I mean, there are a lot of things we can do to help protect those around us who don't have the benefit of the other protections that could be made available. What about fit training? I don't believe, Mike, there's a place for somebody to, or maybe there is. Could I go to Home Depot and get fit tested rather, not trained, fit testing?
Well, so fit testing recommendations are available from NIOSH, but it is an industrial thing. So it's where workplaces will do the testing, but you can do a self-fit check, which is a little bit different. So you put your mask or respirator on. This is officially for respirators, but you can do it with masks too. Put it on nice and tight, and then try breathing in and out forcefully. And if your mask sucks in when you breathe in, it means you're not sucking in air around the side, right? And if it pooches out, but doesn't leak around the edges when you exhale, you're probably getting a reasonable fit. So that's called a self-fit check. But you can look also at the NIOSH website for fit testing requirements, and there's training tools on there as well.
Right. And I'll put into the chat, there's a nice video that somebody put together on how to do a fit test like Mike just described. It looks pretty technical. The woman's washing her hands, wearing gloves, and obviously is in a doctor's office, but you can do that at home yourself. That's right. I'll put that in now. Next slide, please. Okay, counterfeit masking, and that's a really important one. So a couple of issues here. How can I tell if it's real or counterfeit? What's the difference between a quality mask versus a fake? So kind of the same question. And is Amazon a reputable place to buy them? Well, I'll just answer the Amazon one first, which is, as always, buyer beware in the world. We've, I don't know how many of you all use Amazon, but you got to look carefully at what you're trying to purchase. You can look for some evidence that a mask may be counterfeit using tools that Mike alluded to earlier, provided on the NIOSH website. They have some nice guidance on clues that the box or the packaging or something just doesn't look right. And if you have any doubts, I'd sway away from those and move towards those that are from obviously reputable organizations that provide good masking. Anything you wanted to add about real or counterfeit, Mike?
No, but since you unmuted me, I will say that there's a question about people with skin irritation and rosacea and wearing masks. That is really challenging. We work directly with a lot of nurses and health aides and others who are required to wear masks and respirators at work, and we are seeing some challenges there. There are creams and skin barriers that can help a little bit, but I think for community use, sort of finding the product that is breathable enough that you're able to keep it on without too much irritation, but still provides good fit and filtration. And then I suppose the other piece of this is, trying to minimize the amount of time that you're in an indoor space where you want to wear a mask. So shorten the exposure, and then optimize comfort and effectiveness. It's not a perfect solution, but it's a real problem.
Yeah.
There's another question about how many times you can wear an N95. Just very quickly, there's no magic number, right? If you sneeze on the inside of it, you probably want to take it off and get a new one. So it's about whether it stays clean or not. In hospitals, they're usually single-use devices, but we showed that you could use them over and over again when supplies are low, so they still work. In regular community use, I would use the same respirator for several days, keeping it clean in between uses, and then throw it away when it looks dirty.
Yep, exactly. And dirty also includes if you get a splash, like you splash Coke on it or it gets dirt on it, you got to get rid of it and get a new one. And it doesn't matter if they're individually wrapped, so long as they come in a package where you know that what is in the package is certified. Some of them do come individually wrapped, but some come in little stacks. Next slide, please. Let me just see if there's anything we haven't answered here about washing, reusing, and what to do if they get dirty. A reusable mask is any mask that you can reuse, whether it's cloth or an N95. It's really the nature of the mask that determines when you need to replace it or if it can be washed. Again, you can't wash these respirators, the N95s, et cetera, but the cloth masks you absolutely can wash. Surgical masks, those are the blue rectangular ones that look like louvered blinds. I would not wash those either. Those are intended for single use in the hospital to be disposed of, but can be reused as long as they remain clean. And there are definitely, you can buy boxes of 10 or 15, and sometimes they come individually wrapped, sometimes they don't. But if they're sold by a reputable non-counterfeit manufacturer, you can rest assured that they've met the quality standard necessary to put it up for sale. Next slide. Do we expect another variant like Omicron in the future? Well, I sure do. It's just the nature of infectious diseases that it's going to continue to evolve. Whether it will be a more virulent, a more deadly, a virus that makes us sicker, I don't know. I hope not. Many people would suggest that's an unlikely event. But will the virus continue to figure out how to evade our immune system and to infect us more efficiently? That's part of natural selection. And that's sort of what happens in the world of evolution. What you can do to counter that is to reduce your risk of becoming a person who gets infected or of infecting other people where those kinds of events can occur. When a person's infected with the virus is when the virus has the chance to mutate and become resistant or become able to overcome our immune system or vaccines. So by reducing infections overall, we really limit the opportunity for future variants to evolve. Next slide. These are the websites I mentioned before. I know we're towards the end of time, but Mike, I could certainly hang on for individual questions if others are coming up in the chat that we want to address.
I'll just chime in quickly and say, first of all, thank you for letting us have some of your time today. It's great to hear your questions directly. It's helpful to us, and we hope it's helpful for you to hear from us. We really enjoy the engagement and would like to do it again, actually. So if there are other questions down the road, we are not going away. We're happy to do this again. And if you have different types of questions, even if they're not answered by me or John, we can find other people for you. So please let us know. I really appreciate AAPCHO and the National Indian Health Board for hosting this and coordinating. Your voices and your access to the people on the front lines makes all the difference here, and we appreciate that very much.
Yeah. I just really want to echo everything that Mike just said. I want to highlight the what Allison just put in the chat, which is how do you address questions about mask wearing being useless? And I think, I think the science is very clear. They can definitely reduce the risk that people with infection can spread it to others. And increasingly, the quality of masks is to a point where we can say with good authority, they offer you as an individual a lot of wearer protection by wearing one. I mean, I hearken back to the days I would hear wearing a seatbelt is useless. Smoking can't harm you. I mean, the evidence, the scientific evidence is extremely solid that masking is an effective means to protect yourself and to protect others. As we've reiterated, it's one of many things you need to do. And if you want to get the maximum benefit, do all of these things. Get vaccinated. Watch your circumstances. Consider minimizing your contact with others in crowds, especially when COVID is circulating in your neighborhood or in your social circle or in your community or in your school. And if you have concerns, wear a mask. Don't, I really want to empower people not to feel embarrassed wearing a mask. I personally have had taken a few airplane flights recently, and at least from the places I was departing and traveling to, mask wearing was not particularly prevalent. But I was sort of proud to be able to, say, hey, I'm okay. I'm okay doing this. People can't make me not wear it. And I don't know how many of you watched the Tony Awards this weekend, but I was impressed by the number of folks in the audience wearing masks. So if that audience can't be swayed by public opinion or peer pressure, I don't know who can.
So there was one question about masking during travel. I can tell you that I am religious about masking during travel, but it is no longer mandated. And so, with that in mind, it is a community issue. I think that we can wear masks to protect ourselves. And in that instance, again, I've said it how many times this talk, you want to pick one that you can keep on the entire time. And it is also, important to have one that fits as well as possible. I just saw someone comment that I wore my mask and I still got COVID. Yes, that can happen. The challenge is we never know quite where we got it, right? Was it during the flight when you had your mask on the entire time? Was it that brief moment in the bathroom when you took it off because you wanted to, blow your nose? Hard to know. I think that again, Swiss cheese model, where you've made sure you can do everything you can, make sure that you're up to date on vaccine, wear your mask when you're able, keep your distance where you can. And then beyond that, there's the reality that the environment has some threats. We see this during cough and cold season every year, whether you're getting it from your toddler or at work as a school teacher, or whatever else. We are stuck dealing with infectious diseases. It's not going to be zero. The question is, can we do things to make the likelihood lower? And that's where masking can play an important role.
And make sure that if in the event you do get sick, that you're not going to, that your risk for hospitalization and death, severe illness, is substantially reduced. I mean, this is the message behind vaccination, but masking helps add to that by reducing the risk of exposure. Adriana, we have a lot of, maybe people want to ask some questions verbally to us as well. Is that a possibility? I don't know if it's possible to open the mic briefly.
Or if that was yes, sir. So I am single-handedly getting all of your questions in the chat box, all of the questions in the Q&A. If we did not get to your question in the Q&A, I am literally writing them all down so that I can attach them with the slides. At this time, though, what I would like to do is to just take a step back and allow the community to share their thoughts and feelings on the masking. Some of the comments were in the chat box. I just want to make sure that our attendees feel like their voices are being heard. I know we have done a lot of the talking, so I just want to make sure that is out. But one question that I do want to make sure that you touch on, Dr. Brooks or Dr. Bell, is exactly, we received this question from a community perspective and from like a state mandate. 3 different people asked in the chat box, does the CDC no longer recommend wearing masks in the community setting? And so traditionally, I know with NIHB, we were encouraging communities to use the CDC community level map, where you can put in your zip code and it can tell you like your infection rate. But can you just go into a little bit more discussion about exactly where does the CDC stand on renewing that state mask mandates, and why is it that some healthcare facilities mandate masks and then some healthcare facilities do not?
Mike, can you take the healthcare facility one first? Because that's one that's confusing to a lot of people.
So we continue to recommend strongly that everyone wear masks in healthcare settings. There is the little tiny gap where if your surrounding rates are low, you can take your mask off in a break room when you're not near patients, right? If you're working there. But for visitors, patients, and staff that are interacting in patient areas, we continue to recommend wearing source control masks or an N95 respirator if you're a worker doing stuff. So that hasn't changed. To the question that somebody had about, what about these healthcare facilities where people aren't wearing masks? I actually changed my clinic that I go to for my blood pressure because the place that I used to go wasn't requiring masks. And so we can vote with our feet in a way. If you have the luxury of having more than one option, if you're in a community where there's only one place, then I would call them and say that I feel safer when everyone's wearing a mask, and CDC continues to recommend it for healthcare.
Right. And I think the same principle kind of applies to the community levels masking question, which is that we know that in some communities, when the rates of infection are sufficiently low and the burden on the healthcare system is sufficiently low, that the risk of transmission is also lower. And there are certainly circumstances where you don't need to be wearing a mask as often. The point of these community levels is not to say you don't have to wear a mask. It's to say that the risk is lower, but it's still up to you to choose whether you want to wear a mask or not. And that's part of what we've been hoping to try and empower you with, is to think a little bit about, maybe I want to wear a mask in that kind of place. I shouldn't feel ashamed to do that. If that's what's needed, I'm going to do it. Now, if these community levels are staggered in a way so that if they do begin to go up, if the numbers begin to go up, the recommendation to mask increases because we know that masking is effective at preventing transmission of illness. Ultimately, though, now it's up to the individual jurisdictions to decide whether they want to impose a firm recommendation in the form of a mandate or any kind of action to wear masks. And you're seeing in some places that communities where cases are going up, measured by these community levels and the pressure we're seeing on the healthcare system, that they're recommending community masking again as one of multiple measures to try and limit spread and control it and bring it back down. I think voting with your feet is a really important way I look at this, which is, do I feel comfortable going shopping at a place where nobody is wearing a mask? Or even worse, I see people flagrantly doing things that are unsafe. If I have the choice to go somewhere else, I would choose to do so. If you don't have that choice to go somewhere else, you can wear a mask and you can ask people to step back, and you can, you know, move through a space in a way that makes it as safe as possible for you. Um, so there are some things that are under your control as well. Masks can be are available through lots of different venues. I see some of the stuff popping up in the chat right now about where you can order them, or groups that make them available. And there was a large effort earlier this year to get a bunch out into communities. So hopefully if you don't have access to a mask in America today, I'm almost tempted to give you my email because they're so widely available, you should be able to find one. But if that's a problem for you, that's something we want to hear about.
All right, so we are 5 to the hour, so we're going to be quiet. If you would like to just talk to them and ask personal questions, please, this is your time. Let your voice be heard. And if not, if you still want to do the questions in the chat box, we can do 5 more minutes of just them answering the questions, and then we will let you all go.
So I'm seeing
so I've been asked to ask you to raise your hand because our panelists can't. Right, you need to raise your hand so they would be able to unmute you to let you speak.
While we're waiting, there are 2 more questions. Will there be another booster? And the answer is probably. There are several companies that are working on an updated booster. We already recommend the 4th shot for people over 50. I'm getting mine next week. And then thereafter, we will probably have new formulations to try and address some of the new strains. So I'm expecting probably multiple different vaccines coming along for boosters down the road. And then the other question was very interesting. Would wearing a mask reduce how much virus you initially get, and therefore make it likely that you will have a milder infection? Short answer, I don't know for sure. But slightly longer answer, it makes sense. We do know that if your immune system is hit with a lot of infectious material at the same time, there's more work to be done. And if it has time to catch up and stop the infection from taking off, you might actually get away with a milder infection. So strong maybe.
And no reason not to. Okay. I'm not seeing a lot of hands going up, at least by the way I can do that, or other questions coming into the Q&A.
Well, we're
Okay,
definitely not
Will
one and
Micklin.
done.
Will Micklin, how do we unmute Will Micklin? Let me help you. A lot of talk. I got it. I'm figuring this is, thank you, Will, because you're helping me ask to unmute. Oh, who can unmute? Will. Allow to talk. Let's see.
Hi.
There you go. There you go. Is that working?
Yeah, I can hear you. Are you guys hearing me okay?
Perfectly. Thank you.
And I apologize. I wasn't able to hear your question. It started telling me the host trying to unmute you, and it was so loud, the robot, that I wasn't able to hear anything you said there for like a minute.
Sorry.
No, that's okay. It's not your fault. That's Zoom.
Did you have a question?
Oh, was that why you were unmuting me? I was trying
Yes.
to find. Yeah, that's why I wasn't sure.
Oh.
Yeah. So, how would you recommend addressing certain things? Because one of the things that we are trying to combat is the spread of misinformation in our communities. A great example is, well, I literally hear this probably once a week. Well, my doctor doesn't wear a mask in the office, and he tells me I don't have to, and you didn't go to medical school. So that's one of those things that is a little difficult to counteract, because that is a very frequent thing. I live down here in Phoenix,
Yeah.
and that is a very frequent thing there. I've seen it. I've been encouraged to remove my mask in a doctor's office. I don't. I've had COVID 3 times, despite being vaccinated, despite having plenty of fit test training, wearing masks correctly. I've just done too much volunteering around COVID
Yeah.
wards, and just some
Yeah.
bad luck. But fortunately, none of mine were serious, But that's something that's a little bit hard to counteract. Do you guys have any recommendations on how we can combat in the communities when people are throwing out, well, my doctor went to medical school and they think it's ridiculous?
So, I'll just offer a couple of things. First of all, that's intimidation when a clinician does that to a patient. I hope that they have an opportunity. I hope they have a way of choosing or seeking alternative care. I know that in some communities you don't have a choice and you have to put up with what you can get. But that really is not a very respectful patient-doctor relationship, if you want my opinion. In terms of, is there anything you can do to bring attention to this provider's behavior, Mike? I don't know, in the healthcare setting. Is there anything a patient can do if they feel like, my provider wasn't following the recommendations of the local public health authority?
People are, the issue we're seeing is people are very much on board if their provider's doing that. So then they don't believe anything about the mask guidance elsewhere. That's what we're trying to combat.
I follow what you're saying. Okay, yeah. That's more difficult. It's like so many things nowadays, it's hard to find the reliable source of information. I think one of the ways I've responded to that is, look, if we didn't have to wear masks in certain settings, if these prevention measures weren't in some places still necessary, this virus would have gone away. And we're continuing to see circulation. So when you start to feel uncomfortable that you're being put in a place where you could be at risk of infection, please, wear a mask if that's what you feel you need to do. The problem we have is when some people are providing misinformation and suggesting that what's safe, telling people something is safe without understanding the context for what's safe for them. I guess I'm trying to put it that way.
Yeah, I'll chime in and just say
and that's what we're, sorry.
No, it's okay. I empathize. It is a challenge. The reality here is that with so many things, whether it's motorcycle helmets or masks or anything like that, there's a combination of identity, politics, all sorts of things that go into how people want to perceive information. And that is a reality. It's part of dealing with humans. It's what makes it really challenging sometimes, but is something we can't avoid. I think it can be helpful sometimes, not always, to have the numbers at the ready. I find it really, really tragic that every day we're still losing 300 people in this country, deaths to COVID. And those are just the ones that we know about. I think that we need to hold those numbers up and say, you know, the dead people shouldn't have lost their lives at all, had it been avoidable. And we want to do our best to keep another person from dying. Right now, I'm afraid that's the best we can do. I'll be honest with you that, you know, even with influenza and flu season, not everybody likes to get vaccinated for flu. And yet we had 35,000 Americans dying every year of influenza before the pandemic.
Yeah.
Right? That's not nothing. And yet people are willing to ignore it. So it's not a new thing. It is frustrating. But I think having the numbers and trying to share why you are concerned, right? I don't think you can force other people to be concerned, but you can at least share why you're concerned. And what's driving your decisions.
Yeah, I just want to add to what Mike said is to consider 300 deaths a day, even 200 deaths a day, is in far excess of what we would accept with influenza. You know, an average influenza year, about 40,000 Americans succumb. That is about 100 people a day at its max, and we're willing to accept that's already questionably acceptable because we know we've had a couple of years with almost no influenza, and probably many people hypothesize due to the things we're doing now to reduce the spread of COVID. Is it really acceptable to let that happen? And sure, I can't say that death is going to be in your clinic or your community, but as a nation, I think it's something we need to really think through.
Will Micklin has been very patient with a hand raised.
Yes, I know, and I'm trying to unmute Will, or do you want to, can you? Go ahead.
I think I'm unmuted.
Yes.
So, you know, I have concerns. The CDC positions have consequences. People are attentive to them, and if not, then those that influence or influencers to our populations are attentive. And masks, of course, I think you would agree, are the principal non-pharmaceutical intervention that provides the barrier in space to the probability of infection. And I think probability is important. There's a probability, let's say possibility, when we say low probability of being infected from a low dose or low concentration of the virus, whatever space we are in, even if it's outdoors. So I think masks are important, but there has to be, I believe, and this is, I believe, supported by studies that are in preprint and some that are in print, that analyze the issue of dose with the factors of virus concentration, time, breathing rate, and respiratory tract deposition rate as the breakdown of factors that influence the probability of infection. So it's likely unusual for someone to be infected by a standing in close proximity. That's a high probability, but lower in terms of occurrence. But that exhalation of the virus circulates in a space, whether it's a room, classroom, work, office, what have you. And so the assessment of the risk of dose is, I think, essential. And clearly masks in whatever form, whether they are the typical cloth mask, the typical surgical mask, or the non-fit tested N95, or the fit tested N95, progressively provide greater protection, which is generally determined by an assessment of leakage. With fit tested N95 around 10% on a percent of outward leakage, but it's a two-way assessment. So someone with a fit tested N95 in a room with someone with a typical cloth mask is a different calculation than if everyone in the room has fit tested N95s or everyone in the room either has a typical cloth mask or nothing. So the CDC recommends masks indoors only in the clinical setting, I think is not fulfilling the public health duty. It's really encouraging a real assessment of the probability and the factors leading to the probability of infection, and what factors, what variables, and what measures, NPI measures in particular, inhibit the community transmission. And folks read the lack of mandates and the masking only in clinical indoor settings as no mask. It's rare to see anyone in a mask. And that's just a consequence of the public dialogue at this point, and it has led us to a huge surge currently. And I'm free to say that everyone I know is infected and reinfected, but they're not reporting. And if they report, if they're not admitted, they're not reported officially. And that's in large part why the CDC community level by county public health surveillance report with the 3 new metrics of admissions per 100,000 population in the last 7 days, percent of staff in inpatient beds occupied by C19 patients, and the total new C19 cases over 100,000 population in the last 7 days does not reflect the current community transmission rate. Under the old analysis, under the old criteria for the CDC report, it would be over 90% at high risk. Currently, under the new three-part factor, it's less than 5%. And that's such a huge gap that it bears some scrutiny, and we are leading ourselves now to a change in surge from the B212 Omicron to 4 and 5, which are increasing and will be here shortly. And frankly, the gaps in the public health guidance have contributed significantly to this. We are concerned about the B4 and B5 vaccine avoidance, which we don't truly understand. And certainly the long COVID consequences for folks, we definitely do not fully understand. There is only anecdotal reporting on this and certainly needs addressing. But at this point, for this discussion, we really think masking in all settings and understanding and analyzing the means of infection and ways to inhibit and place barriers to community transmission is important. And not addressing that in CDC guidance, we think, is unfortunate. Thank you.
Will, thank you for that. I'll just start by saying that we agree. The modes of transmission have been carefully looked at, and getting that information out is part of why we're here. The masking piece is extremely important, and like you said, the dose piece, the closer you are, the worse you are off. The more time you spend enclosed in a space together, the worse it is. All of these factors add up. So it's not just the mask, right? Masks are the most visible thing, but good air handling, indoor air quality, trying to stay out of doors if you're in groups, avoiding groups if you can, and then wearing masks when you have to go indoors with a group. Those are all things that I think tie together, and I couldn't agree more that they remain essential. CDC continues to recommend that health systems require masks. Not everybody is agreeing, but we still make that recommendation. We still encourage masking. We can't require it because we're not regulatory. But I will say that we continue to stand behind the importance of masking, as well as all of the other factors, the indoor air quality, the types of gatherings, and so on. I think as we see this move forward, I'm hopeful that we'll be in a situation where multiple aspects of this take root, right? This is not a band-aid so much as trying to build capability for the future. I wish we could say that this thing would end and we would be done with the pandemic and go back to quote normal, but I think this is going to be the long haul. And so finding ways that each of those components are sustainable and acceptable, frankly. If a community or a member of a community finds it unacceptable, there's not a lot we can do to force them, especially at this stage of the pandemic. But if we can find ways to make it more doable, more sustainable, I think we'll be in a better place, especially for coming seasons.
I have nothing more salient to add to Mike's excellent comments, other than this action depends on each of us individually. We can at least be an example of the right thing to do, even if we don't have full control over all of the levers that we'd like to see pulled. Thank you, Will, very much for that. And apologies if I got your first name incorrect, for that really helpful comment. Adriana, it's taken us well past time, but time well spent.
And I appreciate the attendees for holding on for us and our presenters. And I love that dialogue in the end. Will, I 100% agree with everything that you said. It is something that we need to take into consideration. And then the same thing with the young lady that spoke before him. I did not catch her name, but excellent comments. We are 24 minutes past, and so I do want to be conscious of the people that's on Eastern time. You've worked 24 minutes overtime for NIHB, and we appreciate the free labor. So I am going to give you back to your evenings. So this is a thank you to everyone. Again, please take the evaluation. Let us know what additional information you need on this topic so that I can compile those questions and get those over to Dr. Bell and Dr. Brooks. And again, I will send those answers to your additional questions with the slides when I send the notification about our webinar being on the YouTube website. Thank you so much for coming. Thank you for your attendance. Thank you for your participation. We are not able to use our reactions, but I'm gonna do the finger praise for our presenters and the hearts and the kisses and the praise. And I just thank you all. Please drink some water. It's hot outside. Drink some water, but also get outside. The sun is good for your skin. It's good for your health. But drink some water, mask up, smile, be happy. Please stay safe. Please enjoy the rest of your evening. Thank you all so much. Bye-bye.
Thanks, everyone. Stay safe.
Bye, guys. Take care.